Welcome back to A Closer Look. In case you're just now joining us, I am with Mike Shoulders. He is an insurance broker, and thank you again for being here.
Happy to be here.
Whew. A lot of information in the first half.
Yeah, there is.
So where were we? We were talking about discounts and all for the hospital. And tell me, I want to probably change the subject here a little bit, but I'm still confused. What is going on with the IRS, and if you don't have insurance, you're penalized?
Correct. For 2017, the penalty still applies.
Okay.
So when you file your 2017 taxes on April 15th, most people will, then if you were not covered through the year with credible coverage, what they claim credible coverage, then you'll be penalized. Or a portion of the year, as I understand it, is going to be prorated. So if your son, for example, were covered for 6 months and then did not have credible coverage for 6 months, then he would owe a prorated amount, half, I would assume, or I don't know if they do it month by month or how exactly they do it. But when he files his taxes, he'll be liable for those penalties. But for 2018, President Trump has signed an executive order eliminating those. So those shouldn't apply to anybody in 2018. Okay. So if
2017 is what we have to worry about. And I do have one son that paid insurance for 6 months and he didn't have it for the other 6 months. When you say prorate it, prorate what? I mean, from what do they look at that they prorate?
Well, for
the cost of the insurance?
6 months of the year or half of the year, he didn't have any credible coverage, so he's going to owe the penalty for half of the year.
But we don't know what that penalty is, what they go by?
Last year it was $695 for each adult in the household, or 3% of the gross family income, whichever is greater.
Wow. That's a lot.
It is a lot. It is a lot.
That's craziness.
And the insurance premiums are a lot. So a lot of middle-class people are just kind of stuck, with that dilemma. What do I do? But then if they have no medical coverage at all and something happens, the medical bills are so exorbitantly high that people really find themselves in quite a predicament. One thing that we do a lot of, Linda, my wife is an insurance broker also, and her name is Bendy Shoulders. She and I do a lot of small group medical, and in the group market, it is not quite as violent. The changes are not quite as abrupt because through the years, 10 years ago, you could have bought a small group insurance policy even if you had that person with stage 4 cancer. And if they had coverage going into the new coverage, it was waived. Their waiting period was waived. If not, they had a 6-month waiting period, but they were covered. So in the past, you could have gotten medical insurance even with serious medical conditions, but there might have been up to a 6-month wait. Now, the group insurance policies have also waived that waiting period for any type of pre-existing condition. Again, meaning that on day one they will be covered. And with a group insurance policy, unlike the individual policies, you can get them the first day of any month. So you might have someone out there who might want to try to set up a small group insurance policy. We can do a group with as few as 2 people.
Oh, wow.
And it could be what we call a carve-out group, where there might be 10 employees, but only 2 want or need the coverage, and maybe those 2 are salaried, or maybe those 2 are management, or there's some way that they distinguish themselves from the other employees. We can carve out that particular class of employee and then offer it to those 2 employees.
Okay, so let's say there's a couple of people that work for someone. Could those, if that someone is not offering them insurance, could they just start a group insurance on their own?
The employer has to agree to collect and remit the premiums to the insurance company. We actually set one up like that last year in a doctor's office. And just the management staff wanted the insurance coverage. So the primary doctor agreed to do it, and she's withholding the premium and remitting it to Blue Cross in this case. But there are only 2 out of 8 people in that office who are insured.
But is it costing the doctor anything?
No.
Okay, so, but they have to remit and do all that sort of
Right.
thing.
They're-
But
they're-
the
they're-
other 2 are counting themselves as the group.
Yes. Now, and again, these rules are so convoluted.
Yeah.
Sometimes you wonder, how did they come up with this?
Right.
This particular group was set up on January 1st. On January 1st groups, we can do it where the employer doesn't pay any portion of the premium.
Okay.
Other groups, the employer is required to pay 50% of the employee-only premium. So you might have an employee and spouse and children. The employee rate might be $300 a month, and for the family it might be another $700. The employer is responsible for half of the $300 that the employee rate costs, $150 in that case.
Okay. All right.
And they can also set up dental or vision or other products on a group type basis. And again, I ran some numbers just as an example on the lowest cost individual policy on your 21-year-old son is $310. But if he were insured under a group, it's $202. So it's a substantial savings in cost. And as you get older, the savings are even greater. A 50-year-old obviously is going to save a lot more. Their premium is going to be higher, but they're going to save a lot more than that 21-year-old.
Okay. Whew.
Yeah.
Yeah, this is confusing. And there's changes every day.
There are.
I love the analogy you gave me. It's like standing in the ocean and the waves hitting you. It's like that many changes. Just when you get one, you get hit with another one.
They do. And as brokers, we get information from Blue Cross, United Healthcare, Humana, all the major insurance companies. They will send us information, and some of it they will send to the administrator of each group, or if it's an individual policy, they'll send a letter or an email to that person. Typically, though, what the administrator or what the individual gets is just the tip of the iceberg. There's a lot of information just simply doesn't need to be distributed, and it's very confusing. And even the simpler items can sometimes be very confusing. And again, a lot of it goes to the vocabulary that's used in the insurance industry. A lot of times, words that I use every day are words that you're not familiar with or have a different meaning to you.
Sure. Wow. Okay, so any ideas of what we can expect to happen this year? That would be changes. I mean, we have a whole different administration. Things are going on. It's been so volatile. I guess that might be going on for a couple more years.
Yeah, I don't know. I wish I had a crystal ball.
Yeah, you probably don't know either.
Well,
it's just so frustrating for people to understand. Like you said, it's hard for you to get all this information with the changes. And it's hard for us, especially with my sons being at the ages they are now, where they're trying to figure out what they can afford, where they can get it, and working for a company that doesn't offer it, and they're trying to get the company to offer it. So they're trying to learn a lot about how the insurance company works and what's offered.
Yeah, well, a couple of things about the Affordable Care Act or Obamacare that are helpful. On the group medical side, again, some of the restrictions and regulations have loosened up, and it's easier to get a group medical policy than it was in the past. And just in the past couple of months, we actually set up a husband and wife group, and they're a partnership. They're partners, so they qualify as a legitimate group, and they have a business. They're the only 2 employees.
Okay.
But we're able to get husband and wife set up as a group instead of an individual policy, and their premiums drop from about $1,800 a month on an individual policy to $1,100 a month on the group policy.
Wow,
Just by
$700
doing
savings
that,
is
right?
a lot.
And another group that we set up, and this one's kind of well, this one is unusual, but it's a one-life group. There are certain situations where we can actually insure one person, and certain conditions have to exist. and you have to have what are called other common law employees. And a common law employee is someone that doesn't have any ownership or is not in any way affiliated with the ownership of the company.
Gotcha.
Or married spouse,
Okay.
except unless it's a partnership. Again, this gets very confusing, but there are ways around it sometimes.
Okay, wow. Mike, you know a lot of information. And I still have a lot of questions,
Yeah.
but it's only because this is something that I'm going through right now.
We talked a little bit, Linda, again, there is a product called short-term major medical. And short-term major medical just exists for a short period of time, hence the name, typically a month, 2 months, or 3 months. And then you purchase the policy, and for 3 months you have coverage. Maybe it's $1,000 deductible and then 80% coinsurance to $5,000 out of pocket. During that period of time, if you have a claim, your claim is paid under those guidelines. And typically there's a runoff period for the next 12 months. If you have anything related to that, then it will cover that as well. But at the end of that 3 months, it's gone. And if you purchase a new, it does not cover pre-existing conditions. A short-term major medical does not cover pre-existing conditions.
It's important.
And that's why they're fighting to even offering it, and why a lot of major insurance companies no longer offer them. Because it does not cover pre-existing conditions, so it doesn't fall under the guidelines of the Affordable Care Act.
Oh, okay.
So, the major insurance companies are avoiding even selling that product because they don't want lawsuits coming up. Hey, you didn't cover this pre-existing condition. Well, you're supposed to,
Right.
and so that's a problem.
That's a good option, though.
It is.
Wow, so much to learn. But I hope it helped clear up a lot of questions people have. It helped me a lot.
Great.
Thank you for joining us this week, and I'll see you again next week with more of a closer look.